Okay, the next tape job we're going to do is for elbow hyperextension. You're going to, again, just like the wrist, put the elbow in slight flexion to protect that injured area. So for the patient's comfort, you want to ask them to hold their wrist here so that the arm doesn't get tired, because you want to keep them in a slight flexed position. You don't want them too flexed in a 90 degree, because then they wouldn't be functional for their sport. But again, you want the actual tape job to be functional, so they will be protecting that area. So if they get too extended or too flexed, it's going to make the tape job pointless. Okay, so he's going to be supporting his wrist here. I'm going to have this area exposed. He's going to have it in slight flexion, so it's about 45 degrees. All right, so you don't want them in 90, and you don't want them in full extension. So I'm going to use the QDA for the tackiness for the tape, and you'll apply the QDA to the upper arm and the lower forearm. Alright, so you'll apply your pre-wrap to the mid-bicep. You don't want to get too close to the joint, and you'll see why in a few minutes. So that covered the mid-bicep, and then you want it at the mid-forearm. Again, not getting too close to the joint. Alright, so you'll apply your 2 anchors at the mid-bicep, starting proximally. And you can do 3 anchors depending on the person that you're taping. So I'll probably do 1 more just so that I'll have coverage for the tape. And then you'll do 2 at the bottom. And run out of tape, just get another one. Okay, just like that. So I have about 1.5 inches to 2 inches between the joint line and the end of the tape job right there. The reason for that is when you apply your star pattern, just like we did with the wrist, again, you're starting at the proximal end of the mid-bicep anchors and the distal end of the forearm anchors. So this is going to be slightly taut. It's not going to be straight across because that tape job is holding him into that slight flexion position. So you want to make sure that the tape lays down. Encourage your athlete to be as still as they can. Again, you're going from medial to lateral with the first part of the star pattern. Again, making sure that it's taped down nice and then lateral to medial with the last part of the star pattern. Again, it's going to be nice and taut. And these tape jobs are easy to wrinkle up, so you want to make sure it's nice and neat. So if it gets wrinkled, it can come off. Okay, so always take your time to make sure you're doing a good job. Alright, again, so you want to pinch the tape here right at the wrist, at the elbow joint, so it doesn't irritate the skin that's not covered. You apply your anchors again. That way the star pattern does not come undone. Distal to proximal at the top. See, the reason for starting all the way at the proximal end of the mid-bicep is because when I cover with my anchors, if it gets pulled or if he tries to extend his elbow all the way, the anchors aren't, or excuse me, the star pattern is not going to come undone because the anchors are holding it down. Important aspect of this tape job to remember so that it's not prone to cut off the circulation is to tell your athlete to actually make a bicep, to flex their bicep. That way the tape job itself isn't too tight. They actually have room to function and move. Okay, so we're going to end off by covering the tape job with ace wrap, starting distal to proximal. And as you're applying the ace wrap, you're covering up by half. If you end up with ends like this, just go across and back down. You don't want to come back down straight. And make your way back up, covering up by half. until you run out of base wrap. And then you'll use tape to lay it down. However much covers the ends of the wrap.